is a demonstration of questioning that you could ask on a court, on a sidelines, to determine whether somebody has a concussion or not, and you need to make a return to play decision. So there's a series of questions that you may ask in order to give you some type of idea of whether that you need to go into a little bit further concussion evaluation. I think the first thing that you've got to do is you've got to look at the mechanism. If you didn't witness the mechanism, what happened? You could ask them simply what happened. You should already know if they've got a history of previous concussions through their medical history, and particularly if you've been working with a particular sport, you would know that. If you didn't know that, you could always ask that. And again, your mechanism, ask them what happened. You're thinking about, was it a coup injury, a contra coup injury? Was it a protected head? Are they just developing symptoms from repetitive use? Or some of the things that you're listening for as you're talking to the patient? You can go on and ask other questions. Did they have a loss of consciousness? Do they have any radiating pain? Do they have neck pain? If they have radiating pain and neck pain, you also have to start to think about, do I have some type of spinal injury which is going to change the course of your evaluation and management at that particular time? That patient's probably not going to be sitting up, but if they're laying down on the field and you're questioning and asking what happened, do you have any pain anywhere, and they say I've got neck pain or radiating pain, you then turn away from the concussion evaluation and probably go to you go to a spinal assessment, and then you may be packaging that person and then transporting them in an ambulance. So loss of consciousness, do they have any pain other than around their head? Do they have any nausea, vomiting? Do they have any dizziness? Do they seem disoriented to you, and you can kind of watch them as they run off the field? If they're running sideways and they're trying to think that they're running straight, that's an obvious sign that they've got balance issues. And you're kind of getting a general sense of that while you're watching them run off the field or you're talking to them in general, particularly if you know the patient's personality. Headache would be another something that you want to ask for. There's some questions from the standard assessment of concussion and Maddox sideline questionnaire that you can ask to get an idea of their orientation, their time, their place, their ability to concentrate and remember things. So on the orientation, you could ask them what month is it, what day is it, what time is it, what's the date, are some of the questions that you could ask for orientation. As far as the concentration part of that, on the sidelines, you could ask them to repeat the months of the year backwards. Sean, can you repeat the months of the year backwards, please?
December, November, October, September, August, July, June, May, April, March, February, January.
Okay, and that would be obviously an accurate reflection of the months backwards. You can also ask them to subtract 7 from 100 and keep going. So I'm going to challenge Sean to do that right now. Can you subtract 7 from 100 and keep going?
All right, 100, 93, 86, 79, 72.
Okay, that's good. And you can go on further, and knowing your patient, that's going to be challenging for some patients. That might be normal for them, but it also kind of maybe gives you an idea in combination with the other things. Are they able to concentrate? As far as their memory, you can give. I'm going to give Sean 5 words to remember: apple, truck, sky, green, carpet. Can you repeat those back to me?
Apple, truck, sky, green, carpet.
Okay. Do that again for me.
Apple, truck, sky, green, carpet.
Okay. And do that one more time for me, please.
Apple, truck, sky, green, carpet.
Okay. And that's an immediate memory that you can take. And then when I'm done with the assessment, I probably should have given him those questions earlier in the assessment. When I'm done, I can come back and ask him to repeat those back to me, looking for some post-traumatic amnesia. And then I can even ask him the next day those questions. Okay. So those are some memory questions that we could ask to kind of give you an idea of how they're able to concentrate, orientate, and remember. Maddox Sidelines questionnaire, what half are we in? Are we winning or losing? Who did we play last week? Did we win or lose the game last week? Are all questions that are off of the Maddox Sideline questionnaire that you could ask the patient to see if they can recall some things that are going on that day and then maybe what's happened that last week. Out of that questioning, knowing the patient, particularly if you've worked with them before, you're going to get a sense whether you think that you're getting some positive results out of that test. If they have some inability to answer those questions, or they report symptoms in the history, and you can tell that they're not oriented, that they're having problems with concentration, that they're having problems with their memory, and anything else positive in the history, that would be a no return to play decision. We're going to make the decision that this is at least a concussion, and make the sideline assessment that this person will not return to play. Your head evaluation can continue beyond that, either on the sidelines or in the locker room or in a setting like this, where you're then trying to maybe differentiate, do they have a concussion or do we have an intracranial hemorrhage? And then you're looking at inspection, palpating the head, doing a cranial nerve assessment, and then on those, you're checking for intracranial hemorrhage and making the decision, is this an emergent situation, needs to go to the hospital now, or do we have just simply a concussion symptoms right now? If that patient, if you decided that they have a concussion and you don't want to take them to the ER, you're going to have to communicate with them by some written instructions in case their symptoms were to change that evening before they report the next day. And ideally, being able to talk to a roommate that would be able to monitor that as well for you and have them contact you should they show signs of increasing intracranial hemorrhage. So, sideline questions to determine if you've got a concussion.